And yeah, we have Dr. Punch here to help us out with helping the early childhood community understand how to use PPE properly and how to make it stretch for as long as possible or necessary, maybe, and probably anything else that comes up that y'all have been seeing over the last few days and the last few weeks. So I'll turn it over to Dr. Punch.
Hi, can you all hear me?
Mm-hmm.
Yeah, okay, good. So thank you for taking some time to hear and to share some thoughts about what to do with the PPE that's going out, PPE you might already have, PPE that is going to come in the future, and what we have been working on with Prepare STL that we distributed to the outreach workers yesterday. I'm a trauma surgeon with WashU and BJC, and I'm also an intensivist, an ICU doctor. I'm working at Christian Northeast Hospital right now as an ICU doctor. I have taken care of patients with COVID. I have been in the coughing, spewing faces of people with virus everywhere, and by the grace of God, I have not turned ill. And I really feel strongly that with just a little bit of extra support, everyone can find a way to be safe from COVID. And so that's the spirit with which I bring this information. So if I could just ask, just for folks who are on the call right now, just a poll, like who here feels confident in your ability to wear a mask all day at work in your places of business? Yes, no. Okay. Because I'm a surgeon and I have had to train for years just to deal with what to do when your nose itches, right? It's a big deal, right? It is not a small thing. You have to be doing like higher level meditation to get through it. But it's everything from like that to just the real deal. So what I wanted to do, I put a couple slides together and then we could do Q&A. I put some slides to talk about, first of all, just a super short, like 1 minute overview of COVID, and then what PPE means, and then the PPE that we put together for the ECEs, and then, like I said, we'll go through the question and answer. So I think I can do screen share, right? Let's see if it lets me. First, I got to get out of this so I can see. Oh, wait, let's do it this way. And I want to get out of the presenter view. So I will go to, there we go. Okay, now we'll share the screen. Oh, it says you have disabled it, Katie. Which you probably did by proxy without realizing it.
Yes. Yeah. Let me see if I can make you a host or something here.
Sorry. I wonder if it's possible to just go to the screen share, and when you pop up screen share to change the rules on screen sharing.
Katie, in the stop video section, there's down with videos.
Try that. Dr. Punch, does it show?
There we go.
Okay, great.
All right, let's see. I want this one. And all right. Come on. Let me get out of that. And let's try that again from here. Sorry, the recording isn't going to be beautiful, but Here we go. Okay, you got me now? Yes. Yes? You see it. Okay. PPE for ECE, that's way too many abbreviations, but y'all know what I mean. So just a little bit about coronavirus. A virus is not a living thing. It is a package of genetic information with little spikes on it. That's what the corona is. That literally spikes itself and injects its DNA into your cells. The cells become infected and multiply, and then you release virus. Oop, it has a mind of its own here, into the environment through your secretions that come out of your nose. Ooh, stop it, stop it, stop it, stop it. I want you to not play timings. Let's try that again. Again, injects its genetic information into your cells, makes copy using your information, and then releases itself into the environment through your secretions. And so it can end up on tables and phones and in the air through cough, sneeze, snot, saliva, but also, this is super important, I think, for the work that you all are going to do, ECE work, that it can be spread by fecal oral transmission. So it's in the poop. So it's a really big deal when you think about what kind of interactions you're going to be having with folks, especially if it's little ones. The thing about it is, when it gets out into the environment, it can last on plastic surfaces 3 to 9 days. It can last in the air 3 hours. In general, it's thought to last on paper for 24 hours. But the biggest thing is it gets on your hands touch everything, and then you touch your eyes, nose, and mouth, where the virus can then create an infection. It then transmits itself to your lower respiratory tract, causing an infection in the deep cells that both move the crap out of your lungs and also help you make mucus. That's how people end up with the symptoms of cough, shortness of breath. It's a pneumonia-like symptom. The thing about it is, it doesn't just stop there. So it can cause a whole lot of other symptoms that are related to any kind of virus type infection, diarrhea, chills, headache, general being fatigued. It does cause this weird thing of not being able to taste and smell. And it can also create really, really serious inflammation in your immune system that then causes damage to your blood vessels, which can cause clots that can cause strokes, heart attacks, and pulmonary embolisms. So it starts as something that should be a cold, but really turns into a very complicated sickness. So how do you protect yourself from a virus that can be in the air and on surfaces? And if you wear a mask, does it really protect your nose and mouth? And if you wear a mask, does it protect other people from what you might have? So the idea of personal protective equipment does include the idea that you need to cover your face, but it's more than that, right? It's clean hands, wearing the equipment right, and making it last as long as possible. Now, this is I put the PPE over my face here because this is a real big problem when we talk about mask wearing, and people do it all the time. And when you're in an environment in which you might need to occasionally expose your face, get access to your face, this is what people do. And I'm going to hopefully show you why, if you do this with your mask, you're essentially saying, I don't really care that I had one on, I might as well just take it off and not wear one all day, and I'll show you why. So let's talk about the PPE kits that are coming out to you all that we made and what they have in them and the ways in which we want you to be able to have complete protection. So the ECE PPE kit we put together has a few things. One, it has 3 of the 3-ply masks. Those are slightly different from surgical masks that you might have heard of. Surgical masks have a fairly water-resistant outer barrier. 3-ply medical masks are 3 plies of fabric that are fused together, but they don't quite have that same moisture barrier. They are still extremely good for protecting your face from coronavirus and really good from you not spewing things out when you sneeze or cough. But they are one tiny step down from the surgical disposable masks in terms of their protection. The way people spread through coughs and sneeze is generally attached to a droplet, but there can be some smaller particles. But basically, this is going to help cover your face and protect you from, again, exposing others or getting exposed yourself. Now, there's also one KN95 mask. Have you all heard of KN95s? You've probably heard of N95s, but you might not have heard of KN95s. The difference between an N95 and a KN95, well, let's just start with what that means. The N95 means it filters out 95% of particles that are less than 0.3 microns. Now, the coronavirus is actually smaller than that, but in general, how it's going to get into the air and get to you is going to be in a particle bigger than that. So N95 is very helpful in terms of how much it filters. The difference is not just whether a mask has the moisture barrier or the filtration, it's how the mask fits on your face. Now, these KN95s have a metal bar across the nose and pretty tight ear loops that they stay pretty nicely on your face, but they're not as tight as the surgical N95s, those green round masks that you see people wearing. The thing is that surgical N95 mask, if you've ever had one on, is not easy to wear for any length of time. It does give you more protection. And if you're in the face of somebody who actively has COVID and is sneezing and coughing, is sort of the gold standard. But an KN95 with a medical mask over top is pretty stinking close to that level of coverage and much more wearable. One of the things we're worried about as we have this material going out is that it's really hard to wear this stuff all day. Now, some of the kits that we've pushed out, and we're working on getting more, also have a band that you can put around the back of your head and hook the ear loops of the KN95 to, so that the pressure is off your ears and on the band itself. There are a lot of different versions of that. You see people have like shower hooks, the S-shaped shower hooks, that there's almost anything you can do to just bridge the gap between, if you're having a hard time having the loops on your ears, bridge the gap with something like that, and it can really help take the pressure off. So there's a couple other things in the kit that might not be intuitive. So I already heard the mentioning of the paper bags. There's a white paper bag and a brown paper bag. And the idea here is that the mask can go in the paper bag and stay there at least 24 hours, ideally 72 hours. The virus doesn't live on the mask, on the paper for longer than a day. And so the idea is that that mask is going to not have any virus on it. But there's more to it than that. What do you do when you go on break? Let's say in your average day, you have 2 times where you get to sit down for a second and put something in your mouth. I know that's not always that way, but let's say, right? And you just deal with the mask like we would typically deal with a mask. What would you do? You'd come to work, you'd put a mask on, you'd work, and then it'd be break time. You take the mask off, you put it in the trash. You take your break, you're ready to come back to work, you put a new mask on. You work, you take another break, take the mask off, put it in the trash. Then you come back, new mask on. And then you work, you're done, you throw it in the trash. That's 3 masks you use in one day, right? That would mean that this kit is good for one day, and then you're done. And if we interact with the PPE in that way, it's going to be really, really hard to get everybody what they need over the course of time. So the paper bag is good for putting the masks in overnight to dry out and to be used again, but it's also really good for storing the mask that you're using at any point in time in a paper bag, so that when you go on break, you put your mask in the paper bag and then you get it back out. Using hand hygiene every time in between when you're touching your mask. So you're getting ready to put the mask back on, wash your hands, mask on, wash your hands again. Every time you touch the mask, hand hygiene. Now there's also, therefore, a little marker in here so that you can mark on the bag, this is my bag. Maybe you even putting the date that you put the particular mask in. We gave you a white paper bag so that the KN95 could maybe be separate. When will you wear the KN95? I think it has to do with a few things. First of all, we're generally suggesting a higher level of protection for people who have any kind of risk factors for severe COVID. Those are folks who have any kind of medical problems, like specifically diabetes, heart disease, and asthma. And we're also recommending it for anyone who has any issue with their immune system or takes any medications that might change their immune system. This mask also, I think, is helpful if you're in an environment where you're having a much closer, frequent contact with folks. So that's another level of protection. So this is what's in the kit. And the idea, oh wait, there's one more thing I forgot. You see that little white strip here? There's a little white strip. That white strip is a piece of double-sided tape. One of the things I see the most, especially with these medical 3-ply masks, is that people put them on and they slip down over the day and they're touching it, constantly adjusting it. That's contaminating your hands and contaminating the mask, and it's not ideal, and it's really annoying. This double-sided tape is actually pretty easy to come by, and it's made for adhesive on human skin, so it's not going to hurt you unless you have an adhesive allergy, just saying. But you can put it on the inside of the nose of the mask and use it to seal the nose down, and then the mask doesn't move. It's incredible. I frequently will keep one mask with that strip on if I'm going to be wearing that mask by itself. Also, when you wear the mask with the KN95, it tends to stay in place much better. Constantly having to touch and adjust your mask is really not ideal. So that's why we added this double-sided strip. So it's going to be really important when people get these kits that they recognize what's in there and they don't just miss it, because that little tiny piece you can see, it's in this other kit here, you just can't see it. And that's why we wanted to put everything together that everyone would need to be able to start their own personal process for PPE, because it's not that your centers are just going to get stuff. It's that every person, hopefully every employee, gets their stuff and then learns how to interact with it and make it last as long as possible. These masks can be reused until the layers, one of the layers is compromised or it's totally contaminated. So if there's any break in any of the material, then that mask is done, because then you don't have the 3-ply anymore. And if it's a situation where there's something like gross, like dirty that got on it, then I think you'd have to retire the mask. Now, in addition to this, each center is getting additional PPE based on how big the center is, which is based on how many folks and kiddos y'all are serving. So this is in the large center. So this is the largest kit that we would offer. This is going to come in 2 big paper bags, okay? We're using paper bags again because the virus doesn't last long on paper. And then there are a number of free KN95s, in this specifically 25 for the large. And there's another 150 surgical masks. There's another 20 white paper bags and another 30 brown craft paper bags. So the idea being that you could make a kit basically for somebody who didn't get one if there's not enough, but then everyone can replenish their kit as needed. But it's very hard to put a number on this per se, but my estimation is that the individual kit that we gave everybody is an absolute minimum 2-week kit, but really could be longer than that depending on how you interact with it and depending on how long you need to use the KN95. But the surgical masks, the disposable masks, if they're substituted out and allowed to dry out, really can last a lot longer than you would think. So here's where I'm sure there's folks in your spaces that have medical exposure experience, have worked, and they're going to know this. But I just want to share with you what I've learned from nurses in terms of how to arrange this, right? So that your PPE stays in the workspace and you don't bring home with you what you got exposed to in the center, and you also don't bring to the center as much what you have at home. And this is the PPE sort of storage area. This is 3 examples from the internet, but this is, I have seen all these 3 versions in real life in the different spaces I've been. So here's the idea. You have your paper bag, you put your name on it with your marker, right? You have your PPE that you keep for you at your center. You come to work in the morning, right? You have your bag, you go to your bag, you put your mask on that's been sitting there for at least a day, and then you're good to go. You're done with work, hand hygiene, the mask goes back in, you're done. So you're not bringing any of this home. You always know you have it at work, and you can identify that easily that it's yours. And again, we gave you the marker so you could kind of write maybe what the date is if you want to keep track. And that's why we added the additional bags. That's also why we gave you white bags separately to keep track of your KN95s. So I've seen it on a shelf like this, where it's just kind of lined up and everybody's name is on it. I've seen it plastered to a wall so that let's say you see it's break time and you're going to go to a private area where you're going to sit and have your lunch. You do hand hygiene, stick your mask in the paper bag, that's yours. You go do your lunch, then you come back, hand hygiene, and you're out. And then when you're in the break room, you're not closer than 6 feet to anybody when you're sitting and eating or drinking or doing whatever you're doing. This is how I have done when I have been in an ICU where like literally there's patients with COVID everywhere and I just got to take a break and drink some water. I would, get into a space behind a door, clean my hands. I have a paper bag. I take everything off. I dunk it in the paper bag, drink, eat real quick, hand hygiene again, everything goes back on, hand hygiene again. And so the paper bag isn't just for storing it in between use, it's for how you get through your day and don't have to throw it away. Now, why does it matter? You might, it doesn't matter. I don't need to beat it. Why do I need to put it in a paper bag? I can just hang it somewhere. Because the problem is any surface that's not paper, right, that you put the mask on, whatever's on the mask will linger, right? So the idea is that by having it in paper, you're limiting how much you might be spreading by junking it here and here and here. And then you don't also have to throw it away. So these are different ideas, and I'm sure everyone can be creative. Maybe you're already doing this, I don't know, but I just really wanted to share this because I think it's a great way of thinking about how to arrange and not, and to really separate what you're doing at home with what you're doing at work, keep it at work. And then with the refills that all the centers have, you just, I need a new paper bag, it ripped. I need another one because, and the last thing I would say is if you want to do the 3-day cycle, you could have one bag that's like Monday, Wednesday, Friday, and another bag that's like Tuesday, Thursday, and you could like rotate out. I don't know. You guys will be creative. You are teachers and nurturers and educators, and you will figure this out, I'm sure, but just want to share. This is also the flyer that's going to go in the mask in the kit, and I just want to emphasize what it says here. A mask is not doing its job. It's not if it's not from your nose to your chin, and if the mask isn't fitting you well, we might have to get you a different mask. We are working on some different size masks so everyone's covered. Not everyone's nose and chin complies with the little wire the way it is there, and it's just really important that you stay covered. If it's constantly moving and you need more of those strips, they're really easy to find. There's a company called Fearless that sells them on Amazon, and then we have some bulk purchases that we have access to. But keeping it there is important. Let's talk about what happens when you pull it down. When you pull it down, you're dragging all the stuff that was on your face and depositing it on your chin, and then whatever was on your chin that got exposed underneath here, you're pulling it up to your face. So basically, you're saying, I don't care that I had a mask on. Anything that hit my neck, I'm just going to smear it up on my face because it should be fine, right? The problem isn't as much the pulling it down. The problem is pulling it back up. The surface of the inside of the mask is precious and should not be touched unless you have clean hands. And you should store it in a place where you're unlikely, right, to get any contamination by sticking it in the bag in between use. Anytime you touch your mask, hand hygiene before and after. There's a recent study looking at how many people got COVID in healthcare settings, comparing washing their hands 5 times a day versus 10 times a day. This is hand washing, not hand sanitizer, hand washing. And there was a significant decrease in COVID with washing hands. So I really think 10 times a day. So I think whatever your system is for hand washing at your centers right now, maybe reducing any obstacles to frequent hand washing. I mean, you guys, again, I'm sure you're experts, but I'm just emphasizing specifically if you're going to manipulate this stuff to wash hands. And then the paper bag trick. Now, you notice I don't have gloves in here. Gloves are important depending on what you're going to be touching, right? But gloves don't take the place of hand hygiene. And you can actually use the hand sanitizer on top of gloves so that you reduce how many gloves you're going through. But what we didn't want to do is give people a false sense of security. I walk in, I put gloves, I wear them all day, I'm good. All you basically did is exchange your hand for a pair of gloves that are then spreading everything. So hand hygiene, with or without gloves, is the more important thing. And you can, like I said, use hand sanitizer on top of gloves. So that's what's going out. That's all I wanted to share. And I'm more than happy to take any questions if anybody has them. Let me get out of the screen share here. If I can. It has hidden itself from, oh, there it is, stop share. And I'm more than happy to take any questions. And I have some more pictures and some more stuff, and I'm going to put what I just did for you into a video form. Yeah, happy to answer any questions.
Hi, Dr. Punch.
Go
I'm
ahead,
sorry.
Tina. Go ahead, Tina.
Okay. All right. I'm sorry. This is Tina Mosley, Dr. Punch. I was wanting to know with the glove part, I follow the mask part, but with the glove part, what about the rubber gloves that are just washable versus the disposable gloves? And I guess the same goes with the, once we run out of disposable mask, the reusable mask.
Okay, two great questions. So first of all, gloves. So I have gloves. Let's say my hands have gloves now. What's the difference between my hand before and after? Nothing.
The gloves are a barrier.
They're a barrier if my hands have a cut, right?
Correct.
And I'm putting them into blood and bacteria and just
Well, like changing
poop.
diapers
Or poop,
and right in the helping children in the restroom. So I'm talking on the ECE side.
So that is important for that moment, right? Because that's stopping your hands from grossly getting contaminated.
Correct.
But the same way after you do that, you're going to take them off and you're done with them. You have to think about the entire environment you're in is now like that. It's like there's stuff that you don't want to touch everywhere.
Where you working?
So you see, so like just the same way, this is actually a great example. Same way you go into the bathroom with a kiddo, you clean them up, you're changing a diaper, you clean them up. Now the gloves are contaminated, right? Gloves are coming off and
Yes,
you're
they
done.
are.
So to do another interaction, you have to have another pair of gloves. Imagine the counter, the doorknob, the table, the coat, the lunchbox. Everything is like that because COVID can live on those surfaces. So in order to interact safely with multiple surfaces, you have to basically act like they're covered in something you don't want. So if you have gloves, you might be stopping, and COVID being transmitted through open cuts, not so much. It's more you get it on your hands than you give it to yourself. So if you want to stop the transmission, the surface of your hands has to frequently be cleaned. Having a glove means nothing. You'll still be touching, spreading everything. A glove might stop you from touching your own face. Now that I get, very much I get that. But it's not going to stop you from transmitting things. So that's why I just think it's super important to, it's not wearing the glove is not stopping you from getting COVID on your hands because COVID can get on the glove.
Correct.
So the surface of your hands is what you must become conscious of. And I think as far as a rubber glove versus a disposable glove, my concern would be your ability to clean the rubber glove in between touching things adequately. I don't have the manufacturer, like warning labels on whatever glove, but one of the big things is surfaces with grooves, like a ring. That's a problem. I don't wear any kind of jewelry in the hospital that I can't cover. So that's another way to think about grooves and notches. They're hard to sanitize.
Right.
This virus is no joke. It's extremely good at spreading and making other people sick. The truth is, an uncontrolled cough or sneeze is a far bigger deal than just a small surface contact, but nonetheless, it still does what it does. So you would have to look at the manufacturer's recommendation for how to cleanse the rubber gloves in between use, and you'd have to think about what you were touching and how you're touching it. And I totally get, if you say these gloves are for diaper changing, I'm going to use them, then just what do you do in between diaper changes? That would be my biggest concern. As far as cloth masks, okay, let's talk about it. So the problem with cloth masks is the degree to which they are able to filter. So that's one problem. And the degree to which they create a barrier. So I used to have, I don't think I have it sitting over here anymore. I used to have a little saline spray, and I can show you, if you spray cloth with a saline spray, it's saturated. even if this isn't a surgical mask, it's a medical mask, there is still some level of moisture, kind of like it, you know, like a droplet sits there instead of soaking through. So that's the difference, both sides, in and out. So
Right.
what you're spewing out and what you're taking in. A cloth mask that has at least 2 layers of cotton gets you at about a 50%, right? A medical mask like this gets you at about an 80%, and an N95 gets you at a 95%. So that's just kind of, that's where we are, right?
Okay.
Now, cloth mask with a filter, that's a little bit of a different thing. And that's what I'm proposing that the general public get access to, because there are filters that increase the efficiency of filtration of a cloth mask. And a cloth mask is easier to wear all day,
Yes.
I think.
Yes.
So here's another idea. And actually, we just got this supply in recently, and I really think we should think about it. If I was you, and let's say I got to a point where cloth mask was the only option, and I was doing diaper changes, I would add a face shield. A face shield totally changes the game, because now you've got a moisture barrier for your entire head, right? So we just got face shields in. They take some getting used to, but once you, after 3 or 4 times of wearing it, you're like, game on. You're like, it just feels like your helmet. You're like ready to go, you know, like it's not that bad. So my suggestion, and we're actually working on getting a better supply of that, is if you need to wear a cloth mask, think about getting an appropriate filter. There are filters that filter as good as N95s, and we're working on that as well. But then if you really, you know, just add the face shield with any high risk activities where secretions are going to be spewed, honestly, even flushing a toilet after someone with COVID has used
Right.
it is not a small deal, right? And so these are the kinds of things to think about. Now, the other thing about the cloth mask is, what do you do when you take the cloth mask out? The same thing, right? It's still great to stick it in a paper bag, right? It has been suggested that COVID only lives for 3 hours on a cloth mask because it dries out so fast. But a cloth mask is going to hold on to your secretions more
Right.
and needs to be. So my official recommendation for a cloth mask is everyday wash. My
Yes.
unofficial recommendation is maybe like, you know, every other day at most, you know, just saying. Depends on if you wore it all day. If you wore it all day, forget it. And then you have to take the filter out and let the filter dry out. And once the filter layers get compromised, you can't use that as well. So cloth masks, I think, have a role for the general protection, but they don't necessarily have a role in high risk contact unless you have another layer in front of you. Question here, would you suggest staff wear masks into the building from home, or come into the building with no mask and place the mask on when they get inside? Also, what about staff who want to use their own masks? Is that a risk bringing anything from home? That's an excellent question. So my suggestion, I'll tell you what I do, is mask on. You don't walk in the building with the mask off. So it's fine to bring the mask in, because what are you going to do? You're going to have somewhere to put your mask from home, I'm sure, right? You're going to stick it somewhere that's not going to contaminate anything. So you have a paper bag for your mask from home and you dunk it, hand hygiene, and new mask on. That's totally fine. And I would not suggest you leave the mask in the car, walk in the building, because one sneeze and it's just like you pulled out an AK-47. I'm sorry, but it's like that, right? So keep your face covered. As far as bringing masks from home, my question would be, why, if there's a supply issue and you have surgical medical masks and you want to bring them, I mean, I just feel like then bring a couple to the center and leave them there. Again, it's just so great to be like, when I'm here, I'm doing this, you know, and this is my space here, because I just feel like it makes it a little bit of a cleaner, you know, way of thinking about this is my supply at work. But if you want to bring a cloth mask from home, I think, again, it needs to be 2 layers of cotton at least. And I don't think it's adequate protection for you in high risk exposures. I do think it helps you be less likely to make everyone else sick. And if that's the only option you have, consider adding face shields for high risk contact. So I kind of already answered that. Shoe covers, are they necessary? Okay. This is where I'll share what I've learned from actually a group of emergency medicine doctors, which is a protocol in and out of the house. So when you're leaving home, you've got your clothes on for the day. You're going to put your shoes on. Hopefully these are clothes that you just laundered and you're having minimal contact as you're going out the door. You're at work, and then you're going to come back home. You don't want anything that you were in at work to actually come inside your home, in my humble opinion. Or you want some kind of like pathway where you strip down. I mean, you know the stories of people like stripping down on the front porch. You don't have to go that far, but like I basically have a entryway. I'm living in my basement to keep my family away from me when I'm doing medical stuff, and until I've passed 7 days of quarantine. I've been out of the hospital for 9 days now, so that's why I'm out and about without a mask on in my own home. But basically, I'm coming in, shoes are outside on the steps, clothes immediately off straight to the shower, start with washing hair. That's how I've been doing. And I think hair covering is way more important than shoes, because shoes are what they are. They're everywhere. And a shoe cover is just like gloves. The second you step in something, then it's already contaminated. Now you're just spreading stuff in the shoe cover versus the shoe. So I don't personally think it's meaningful. I think covering your hair and controlling your hair. I've had people at my building who have been volunteering making PPE kits come in. And when there's a lot of hair, it's basically impossible to not touch your face and for the hair to not touch what you're working on. That's a risk both ways. And hair is like fabric, so the virus can't live on it for some time. So my suggestion is to pay more attention to what you're doing with your hair and your environment than your feet. And for your own protection, leave your shoes outside. No work shoes inside the house. And if that's really difficult for you, what you do is when you get close to wherever your home is, in an apartment or something, guess what? Take a paper bag, shopping bag, dunk in the paper bag, and don't get them out again. Make these be your work shoes and you don't mess with them in between. I have a lot of paper bags in my house right now for all this stuff. Like, just don't touch it, don't touch it. One of the hardest things for me has been trying to eat or drink something at work. It took me a long time to get over the anxiety of taking my mask off, but that's the environment I was in. But I'm worried for any of y'all who have workspaces where there's not a separate environment to eat or drink in, or where it's really crowded and everyone has to take their break at the same time. There's just something to be mindful of, that sometimes we can feel like just because we're in a different space, like we're safe, but those shared break rooms can be a place where you're going to really need to tend to the hygiene really well and have some kind of, no more shared coffee cups. Styrofoam's coming back, I'm sorry, but like you just can't, like you can't wash the same. You just have to change, that's another change. Be like Mr. Rogers. Yes, take the sweater off. Yeah, the logistics, I don't know how many of you are back to work already. I don't know how many of you are getting ready to start, but the logistics, it's all these details, right? It's all these little things that you're like, oh no, I just totally contaminated myself. I wasn't planning for it. Okay, question. Would I be willing to discuss children 2 years or older wearing a mask in childcare settings? This is a source of confusion for childcare providers and the orders recommending children wearing masks. Okay. This is where I think the CDC has once again failed us, because before they said, right, don't wear a mask, and they said it for way too long, and it was just so wrong, and I knew it was wrong. And now they're saying 2-year-olds should wear masks, and I don't have to tell anybody in this group, are you kidding me? Like, really? In fact, what you might be doing, if by the grace of God, hopefully they don't, but if they have COVID, you just created like a mechanism to make sure they share it with as many people as possible. With the mask is here, all over their face, everywhere. Having said that, I'm just going to say from a medical standpoint, there are kiddos that have some pre-existing health conditions, right? And that's who I'm worried about. I'm worried about the kiddos with super bad asthma, the kiddos who are on some kind of medication that changes their immune system, the ones who've had tubes 3 times over and get colds every 2 days and are just, sick kid. I don't have to explain, you know what I'm saying. I'm worried about those kids. And I also think some of the kids who have been sick at a younger age actually might be able to do it. you know? So we are actually working on a supply of cloth masks with filters that are kiddo sized. Because I think there's going to need to be some times when that's going to be indicated. Do I think it is a good idea to say every child over the age of 2 must wear a mask all day in childcare settings? Why would you tell somebody to do something that's going to be completely impossible?
Amen.
So what we've got to do is maybe
Thank you,
kiddo,
Dr. Punch.
Right.
kiddo,
Right.
maybe kiddos have to wash their hands 10 times a day. Maybe you make it a game.
Would you recommend like every 30 minutes? Is that too much? But I just know they're touchy feely.
That's a lot. That's a lot.
Okay.
But I think
And
you have to work. I think if it becomes like, this is how our day is, and it's not just that we do it at the potty break time, but we do it like, you know, you make a song out of it. And I feel like that could be far more impactful. I also think, I don't know, your centers will obviously be making arrangements for how to use your play areas. I mean, I'm not even trying, that's not my expertise, but distance still does matter. And then the only other thing is, if you have your facilities people looking at your airflow. Like, did you see the article that had the restaurant in Seattle where, yeah, right? So like the AC was rolling this way. So like, yeah, so like everybody in this direction got it and everybody in this direction, like everybody got it here and nobody got it here when it's going the other way. So that's higher level, but you can maybe talk to your folks about it. But I do think we should make masks available for kiddos who can stand it. What my bigger thing is, how are you going to know, right, the difference for the kid with the sniffles and the fever for some other reason, and the one who really, yeah. I think you have to stick with your current practices around fever and symptoms, because the problem is, you know, kiddos are frequently asymptomatic. My question is, what are you asking about their homes, and how invasive are you allowed to be, right? In asking, as the kiddo's coming in that day, is anybody at home sick? And has there been any exposure? I think that's the bigger question. And I would ask you, these are the kinds of conversations I think your centers will need to have. So the final answer for is, it would be nice if kiddos who are at risk could wear masks up to as little as the age of 2. There are other mechanisms that are super important as well in protecting kiddos, including hand washing and distance as much as you're able. But screening and getting a sense of the collective exposure, both of your coworkers as well as in your staff, as well as the kiddos' family and sphere, is going to be really important. One of the ideas that's been put out there is the way the city is not ready to do contact tracing. Contact tracing is this: like, let's say we get to a steady state, we're fine, we're like humming, it's not that many people and we're handling it. And then there's a spike, all of a sudden there's a cluster. How do we, real quick, like find out, where'd you go, who'd you see, where did it come from, shut it down, like just put a safety net around that group so that we know what's going on. And, you know, I'm hoping that we get better at being able to do that in the city for times when outbreaks might occur. I would say one more thing. I had a COVID scare myself. I had a day, had a low-grade fever. I was not feeling well. The fever was low, but it was still, I didn't feel right. And I remember thinking about all the places I had been, which wasn't many, but I had done some essential stuff. And I thought about things I had touched. I thought about my family. I thought about, oh my God, did I potentially make somebody sick? And it was really hard. It was really hard to just be like, just get past the trauma of this moment and call. Just make the phone call so you can get tested. And I think we're all going to have to like get past that moment of like, it almost feels, for me, it felt like a failure. Like I was like, oh man, I did all this stuff to try to protect myself and I still ended up with COVID. I didn't, and I'm fine. And I was fine the next day and I got tested. It was all right. But I really encourage everyone to check in with themselves every day and make sure you're not having any of those symptoms I mentioned, and that you have a mechanism for checking your temperature every day, because I think that's helpful as well. There's one more question. How often should you be tested when working with children? That is beyond my ability to answer. I know that there are places that are testing people like literally every day, and I know that there are places just to keep the workforce, right? And but it's just not realistic to think that we'll be doing that. I understand the particular concerns because children would be more likely to present without symptoms, and so you won't know if you've been exposed. I think new testing capacity is coming, but that is beyond my expertise to make a recommendation there. The truth is, the recommendation is limited by the capacity. We can't, and so we're not. That's why we have to use all these other mechanisms to try to keep ourselves as safe as possible. This is a non-official medical tidbit as well. I have been taking and eating as much plant-based food as I can, and had a particular focus on superfoods like beets and dark chocolate and greens and garlic and red wine. These are all foods that support the health of your vascular system, and COVID has some of its nastiest presentations in your vascular system. Also vitamin C and vitamin D. So this is not official, but I think it's true. Food is medicine. And so something else to really think about for all of us, if there's any way we can increase the veggies in our diet and get ourselves with a good set of superfoods and fruits, we will be doing ourselves quite a service. Well, any other questions? I don't want to keep you all too long. I really appreciate you going over this with me, and happy to answer anything else. I'm also totally available. Katie can find me if there's more questions in the future.
Really quick, I have one more, and it's basically creating what you said about the questions. How invasive can we be talking to the parents when they come in to deliver their children to us? Is there a list of questions you could give us that we can just use on a daily basis, like when we go to the hospitals and the doctor's offices?
Yeah, I mean, I would be happy to forward. There's a bunch of standard screening sets of screening questions. I'd be happy to forward that.
Thank you.
Awesome. Yeah. Thank you so much. As some folks have put in the comments, thank you for your time and for your real attention to details that are specific to the early childhood community. We really appreciate the time. And we're going to make the video available. And I think you mentioned that you're going to put together some maybe more quick tidbit kind of you've done on Facebook and others. So that'll be awesome. We'll make sure those are getting out broadly too, but we especially wanted the hub leaders who are on this call, who are going to have people coming to pick up those big bags full of things, to tell people, don't just wear them and toss them, wear them and keep them, sort of thing. So any other comments, questions before we sign off? All right. Well, thank you all. Stay safe, Dr. Punch, and thank you for your leadership.
Absolutely. All right. Take it easy, everyone.
All right.
Bye-bye.